Israel is a small country with only 7 million people. And even in the world's most violent region, Israel's infant mortality rate is lower than America's, and its life expectancy rate is higher. So medically speaking, the Israelis must be doing something right. Some would say that comparing the U.S. and Israeli healthcare systems is like comparing apples and oranges, because the U.S. has more than 40 times the people. But with the healthcare debate raging in the U.S., polls show that at least 80% of Israelis are satisfied with the care they receive. And that, supporters say, is worth looking into. The Israeli healthcare system is usually referred to as socialized medicine, but some say it is actually a mixed bag. Bruce Rosen directs the Smokler Center for Health Policy Research in Jerusalem.
Most of the financing coming from the government, and that's good because that makes sure that the system is equitable and everybody has access.
But Rosen says the system works because there is market-style competition. Each citizen chooses from 4 non-government providers called sick funds. By law, the sick funds must provide a benefits package that covers hospitalization and doctor's visits. The co-payment for most drugs is nominal. Procedures ranging from in vitro fertilization to liver transplants are provided to anyone in the system, usually without a long wait. The system is paid for mostly through income taxes. Israelis pay much higher taxes than Americans. Even so, many who have received care under both prefer the Israeli system.
I was in America for the past 3 years, and I'm a lot more satisfied with the health system here. Especially, I have 3 kids, and I visit doctors for all different reasons, and I find them very easy to access, very easy to get to.
It's great. It's like, yeah, it controls prices. It has really good standards of care. Everything's really based on best care, best practices, and you get what you need. You don't necessarily get nice waiting rooms, but you get everything else.
Healthcare developed here even before Israeli statehood, but it wasn't until 1995 that the National Health Insurance Law mandated universal coverage and specified the benefits.
Every citizen is insured, doesn't matter if he has money or doesn't have money. Mm-hmm. Everyone has to pay health tax, which is around 5% of his salary. But if he has no income, he still gets the same service.
Professor Shlomo Mor Yosef is the Director General of Hadassah Medical Organization. He also heads a national committee that recommends improvements to the Israeli healthcare system. He says statistics show that the Israeli system is cheaper and provides better care overall than the American system.
For Americans who have good insurance, the service in many places is better than the average in Israel. But if you compare on a national level, the service in America, in the US, and in Israel, and you measure outcome, not just the process, so the outcome here for sure is better, and the cost is less.
The Israeli system does have its problems. Medical care is better in cities than in rural areas. Professionals are forecasting a shortage of doctors and nurses, and there is never enough money. Dr. Elisha Waldman, a pediatric oncologist who worked at Sloan Kettering in New York before moving to Israel, says low salaries for doctors are causing many of them to consider leaving the country.
I think it's a serious problem that this country is going to have to deal with. And this is probably the Achilles heel of the socialized medical system here.
But Waldman, who spent time in a private practice, says Americans have their problems too.
People don't like to hear this, and people don't like to think about this, but medicine is a business. The same way as the guy who runs the corner store needs to have a profit margin on selling milk and bread, private medical offices need to have a margin of profit.
Despite the challenges with Israeli healthcare, medical professionals from the U.S. are consulting Rosen's Institute to see what they can learn from Israel's program.
For example, our system of electronic health records. For example, how we do primary care in an effective way. How we keep people out of hospitals unnecessarily. How our health plans are mostly there helping the doctors do a better job and not getting in the way with bureaucracy.
Rosen says the main message Israel has to offer is that a healthcare system can give good care and not leave the poor behind. Chris Mitchell, CBN News, Jerusalem.